Egypt has great interest in developing the health field through the initiatives of President Abdel Fattah al-Sisi. And one of these initiatives that proved its success is the initiative of treating some diseases such as virus C, diabetes, blood pressure, and obesity. The prevalence rate of the C virus in 2018 was 7%. Then it reached 2% in 2020. $70 million citizens over the age of 18 were examined as part of the initiative, and 2 million citizens were provided with free treatment within 7 months as part of the initiative of the President to eliminate virus C and early detection of non-communicable diseases. Egypt is on its way to obtaining international certification for hepatitis-free after it was one of the highest countries in the world in spreading the C virus among citizens. The President's initiative to eliminate HCV was launched in October 2018 through a national campaign for the early detection of hepatitis C virus infection and non-communicable diseases, diabetes, high blood pressure, and obesity, and presenting evaluation and treatment service through treatment centers. 70 million Egyptian citizens received the medical services provided by the initiative concerned with the elimination of HIV, C, and the early detection of non-communicable diseases. A medical survey was done for 50 million Egyptians as part of the early detection of non-communicable diseases and treatment for 1.8 million diabetic citizens and 10 million hypersensitive patients, with 19% of citizens with high blood pressure were detected. Presidential initiatives included the ending of the waiting lists for critical and urgent cases, as the waiting rate for surgeries in 2018 was 3 months, during which 9 surgical interventions were performed. Then it reached only 1 week in 2020, during which 11 surgeries are performed for patients. As for the total costs of the initiative to eliminate virus C and early detection of non-communicable diseases, amounted to about £4 billion, including £2.5 billion for the cost of scanning and £1.5 billion for the cost of treatment. The initiative contributed to exempting the country from bearing the cost of treating the virus C and its complications, which reached £64 billion annually through early detection and treatment of the disease. The campaign also succeeded in early detection of diabetes, high blood pressure and obesity, and directing the patients to receive treatment in various units and hospitals of the country. President Abdel Fattah el-Sisi's initiative to eliminate the virus and detect non-communicable diseases under the slogan 100 Million Healths is a national campaign, as it succeeded in treating 2.2 million patients with hepatitis C, confirming the low infection rate. It is worth mentioning that the high-level global dialogue organized by the World Health Organization with the same day of the World Hepatitis C Day on July 28th of each year with the participation of a number of health officials and international organizations to review and share the experiences of successful countries in eliminating the C virus and discuss ways to accelerate its elimination by 2030. According to the directives of President Abdel Fattah el-Sisi, the Egyptian government has put the health sector at the top of its priorities, which in turn contributed to strengthening the health system, stressing on the importance of sharing and exchanging the experiences of health systems around the world to achieve the goal of eliminating hepatitis C, which threatens public health by 2030. Egypt was one of the countries that suffered the most for many years from hepatitis C, which was reflected negatively on the health, social, and economic levels. Egypt is now a leading country in the field of paying more attention to public health and the elimination of hepatitis, as the World Health Organization is on its way to declaring Egypt the first country free of hepatitis C. The WHO and the World Bank play an important role and give support to Egypt during the initiative, in addition to the sustainable partners from international organizations, the private sector, and civil society, who played a significant role during the completion of the Zero C initiative in Egypt. The main factor for the success of the initiative to eliminate HCV is the permanent coordination and cooperation between state institutions to support the health sector in Egypt and join hands with the state's efforts to meet all challenges, especially during the coronavirus pandemic. HIV-C testing was carried out as part of the initiative using the hepatitis C rapid diagnostic test, as directed by the World Health Organization, and immediately transferring patients to treatment units, confirming Egypt's ability to locally manufacture hepatitis C drugs at competitive prices compared to the global price. There is a keenness of the Ministry of Health to raise the efficiency of human resources from the medical teams and workforce of the initiative through continuous training courses, the development of research capabilities, and data collection as a main pillar. The laboratories for conducting PCR analysis for the C virus have also been expanded, which contributed to Egypt's possession of an expanded PCR laboratory network during the response to the coronavirus. The coronavirus pandemic gave a lesson for solidarity, cooperation, and rapid response between the countries of the world to protect health systems, which indicates the importance of continued cooperation between countries in order to eliminate hepatitis C, and Egypt's keenness to share the knowledge and experiences gained during the elimination of the C virus with all countries. Egypt is also working to continue to support healthcare for African countries by transferring Egypt's experience and applying it within the initiative of President Sisi. Support the World Economic Forum's Search for the Lost Millions initiative to detect people living with HIV in all countries of the world, calling on the World Health Organization and international partners to intensify their efforts to support all countries to move forward with national plans aimed at eradicating hepatitis C with the aim of achieving the Sustainable Development Goals. It is worth mentioning that for the celebration of World Hepatitis Day, the Egyptian Ministry of Health and Population lit a number of monuments and hospitals, including the pyramids, Salah ad-Din al-Ayyubi Citadel, the headquarters of the Council of Ministries in Al-Alamein, Ismailia Medical Complex, the Liver Institute, Nasser Institute Hospital, Zaid Specialist Hospital, the Comprehensive Health Insurance Authority's complex in Bursaid, Karnak International Hospital in Luxor, in addition to operating a number of cars nationwide to support the medical staff and spread awareness messages and invite the citizens to participate in the initiative to maintain the health and safety of them.